Hello, everybody. It's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health. And this is a special edition of our normal weekly update. As most of you have probably already heard, yesterday, March 2nd, the governor and DHEC announced the opening of Phase 1B. Very exciting. We thought we'd put out an extra video this week to make sure you had the most up-to-date information. So I'm going to jump right to it. I want to share with you DHEC's website, which now has this updated information on it around 1B, in case you were not able to listen to the press release. Let's start right here. So we're going to that COVID-19 vaccine site that I point you to regularly. And when you scroll down, we have been focusing here on that Phase 1A, and a few weeks ago we opened that up to 65 and plus. But beginning next Monday, March 8th, we're opening up to Phase 1B. So who is in 1B? Right now, that's anyone age 55 and up. So we've added a new decade into folks who are eligible. There are also, for those folks between 16 and 54, eligibility for people who have chronic disease. You can see them listed here: cancer, chronic kidney disease, chronic lung disease, diabetes, Down syndrome, any type of heart disease, HIV, AIDS, organ transplant, obesity, pregnancy and sickle cell disease, or other developmental or severe high-risk disability. In addition to those categories, we also have frontline workers who have increased occupational risk. Now, this means they must be working in person at their work site. It must mean that they are in frequent contact with others for greater than 15 minutes and less than 6 feet apart. And you can see here some examples. Daycare workers, school staff, of course, very important, manufacturing workers, grocery store workers, law enforcement, and there's many, many more people who fall into this category. And then finally, individuals who are working or living in group settings that put them at higher risk. And you can see here some examples of homeless shelters, group homes, correctional facilities, and so forth. And then, of course, anyone who is in 1A who hasn't been vaccinated yet. So this is very, very exciting. I will say that the estimate is that this is about 2.7 million people. I personally think it's probably even more than that. I will tell you that DHEC and the governor mentioned yesterday that while for 55-year-olds, you'll be able to show an ID to prove your age, but for these other categories, no attestation is needed, or let me rephrase, no proof is needed. There will simply be an attestation that you will sign and fill out when you are scheduling your vaccine appointment. There were several reasons for this. One was that they did not want the healthcare system to be inundated with folks simply trying to get proof that they're due for the vaccine. So please do not reach out to a provider, a primary care provider, or other urgent care provider to get a note that says, yes, indeed, I'm eligible for the vaccine. Don't do that. It's not necessary. One thing I do want to mention, and I just throw it out here for folks to be thinking about, is this is a huge number of people that have just been added to the number of folks who are eligible to get the vaccine. We may see in the days to come further prioritizations. Okay, so while March 8th is the date that this is going to become open, vaccinations are going to become open to this group, please be on the lookout for additional nuanced recommendations around who should or should not get the vaccine at this time. Okay, I also want to mention that if you scroll down, you'll also see they have put an approximate date for Phase 1C, which will be anyone age 45 and older and other essential workers who had not met the previous criteria of close contact. So you can see here some examples are construction workers, delivery drivers, utility workers, etc. And there's also an estimated due date for when the vaccine is just open to the general public age 16 and older. So we're really seeing some aggressive movement here. It's all very exciting, but let me tell you, we don't necessarily have a tremendously huge amount of supply coming, okay? The supply is still very limited. So it is very, very important for you to understand and for you to message to your employees that while there may be many, many folks who are eligible, this is a process that is going to take months to vaccine all of these people. There simply is not enough vaccine to get 2.7 million additional folks vaccinated in the next days to weeks. So please be very, very patient as folks begin to try to make appointments, and we'll talk about how you do that in just a second, for vaccines. They're going to find there's going to be limited appointments. In fact, some organizations may not even release appointments until they know what their vaccine supply is. And that's information that these vaccine administrator sites only get on a weekly basis. So they only know each week what they're going to have for the next week. So you're going to need to emphasize patience, that someone who may be eligible starting Monday may not be able to schedule to get their or find an appointment to get their vaccine for many weeks, but that's okay. We will get everybody vaccinated. Remember that schools are a big and very important part of this. You may have heard Molly Spearman's plea to the public to understand how important it is to get our teachers vaccinated. We also understand how important it is to get our essential workers and our folks who are medically at risk vaccinated. So there are lots of priority areas here with a limited supply. So we're all just going to have to take a deep breath and do what we can. So what can you do now, especially given that supply is limited? As I mentioned before, please encourage your employees not to run out and inundate the health system simply to get a note that says, I need the vaccine right now. That's not going to be helpful. But what you can be doing and what you can be encouraging your workforce to do is to register for MyChart. Now, this is the system that Prisma Health uses for inviting and scheduling eligible folks to get their vaccination. And so one way you can do that is to click here on the Get the Vaccination site, and it will show you how you can register for MyChart, or if you'd rather do this by calling someone and having them walk you through it, here is the phone number for that. Okay, you can imagine these folks are going to be phenomenally busy over the next few weeks because many, many people are going to be calling. So again, patience, please. Getting signed up will take some time. Okay. The other way to do this, however, is for us to help you register your workforce in VAMS. You may remember this is the system that, excuse me, Prisma Health was using before we moved to Epic and MyChart. And we can assist you with that. If you'd like to reach out to us and find out how we can get your workforce entered into the VAMS system, what will happen at that point is an invitation will be sent to your employee electronically, and the employee can go ahead and register and schedule a vaccine. Now, if they use a Prisma Health site, if they want to schedule their vaccination appointment at a Prisma Health site, VAMS will then tell them, please register for MyChart. So eventually it will send them back to this process. But there are other vaccination sites and community events and opportunities where folks can get vaccines that they can access through that VAMS registration. So if you'd like to reach out to us, I'm going to quickly click on our page here. This is the Prisma Health Creating a Safer and Healthier Workplace page. This is our business health page. Scroll on down, use this number to reach out to us if you'd like us to help you with that VAMS process. If you'd like us to help you get registered. We can also help you in a variety of ways, work with your workforce to get them registered with MyChart. If they'd like to do that, we can do that through electronic webinars, or excuse me, virtual webinars, with either leaders in your organization or with the employees themselves, or even a group of organizations that want to have that kind of training. We can do train the trainer type events, either virtually or in person, so that we can get a group of your team ready to get folks registered in MyChart. Or we can come on site and do some of that registration for you. But we want to help in any way so that we make sure that you're getting your workforce entered either into VAMS or MyChart, or ideally both, so that they have increased access to all the vaccine sites and appointments, although again, keep in mind they will be limited for a while, but also that it's easier for your workforce to get through that. And for those folks who may have a little bit of technology hesitation or don't have access to Wi-Fi or don't have a computer, this is a great way for us to help you get those folks registered and in the system and ready to go. Let me be very clear that as a business, if you reach out to us and engage us in helping your workforce become registered in MyChart or VAMS or both, that does not mean you're registering for an on-site vaccine clinic. This is how you get access to all of the vaccine administrators across the state, whether that's a Prisma Health site, whether that's another healthcare system site, whether it's a DHEC site, or whether it's a pharmacy. So this is not to register for an on-site vaccine clinic at your organization, but more to help get your employees registered and in the system and ready to go and ready to get those appointments as they become available. All right. Now, the other thing you can be doing is surveying and educating your workforce. So I'm going to stop sharing my screen for just a moment here as we pause. We are planning many different ways to facilitate vaccinations for folks who are in 1A and 1B in the long term as we get more and more vaccine. And so in the meantime, it would be important for you to determine what sort of numbers are you talking about in your workforce? Who's interested in getting the vaccine and who isn't? Also addressing vaccine hesitancy, because we want as many people to get vaccinated as possible. We honor that folks have different concerns and questions about the vaccine, and we'd love to help you work with your workforce and educate them, answer their questions, maybe allay some of their fears, and possibly get someone who was on the fence more excited about getting the vaccine. So reach out to us about those opportunities as well. All right, let's talk for a moment about Johnson & Johnson, the new vaccine that was given emergency use authorization on March 26th, last Friday. This is a viral vector vaccine, very common technology for and mechanism for administering vaccines. We've been using this for a very long time. One of the questions I get most often is, well, if it's delivered to me through a virus or part of a virus, why don't I get sick from that other virus, that viral vector? And it has been incapacitated. It cannot reproduce. You cannot be infected by that virus. But one of the neat things about viral vector vaccines is that not only does your body mount an immune response against the part of the vaccine that looks like COVID, it is not the COVID virus, it is a piece of its RNA or genetic material. When your immune system responds to that, it not only codes your immune system to respond to COVID, but the fact that it's delivered by an inactivated virus actually boosts that immune response. And that's why these vaccines can be incredibly effective. Now, you may have heard that they do not have the same efficacy rate as the mRNA vaccines. Remember, you're comparing apples to oranges here. Not only are they two different kinds of vaccines, but they've been studied in different geographic areas. It may be that our Johnson & Johnson, or you may hear it referred to as Janssen, vaccine is actually more protective against variants, since we don't have great data about variants with the mRNA vaccines. So the bottom line here is get whatever vaccine you can. Do not be hesitant about getting the Johnson & Johnson vaccine because it doesn't have the same numbers at first glance that the other vaccines do. It is still highly effective, and guys, it's one dose. So it's very simple, one and done, and you're protected. The great thing about the Johnson & Johnson vaccine data is that it shows it's incredibly effective at preventing hospitalizations and deaths. And honestly, that's really what we're shooting for. We don't want people to feel sick, but we all get colds and respiratory illnesses from time to time. We don't want those colds, respiratory illnesses, viral infections to cause hospitalization and death. So that's what we're trying to do and eliminate with this vaccine. Johnson is these vaccines, and Johnson & Johnson is very good at that. South Carolina is receiving a little over 41,000 doses of the Johnson & Johnson vaccine this week. I have heard from DHEC that the first round of Johnson & Johnson vaccines are going to be going to about 140 newly designated vaccine administrator sites that have not been able to administer the vaccine yet. In the future, the plan is to send the Johnson & Johnson vaccines to the FQHCs, or federally funded health centers, DHEC clinics, mobile clinics, pharmacies, and of course anywhere else that we can send them given supply. All right. We talked about getting whatever vaccine you can, and the reason for that is something you've probably heard off and on for the last 12 months, and that is we want to create herd immunity. And what we're shooting for in our communities and in our state and in our nation and on our planet is 70 to 75% of folks having been exposed to COVID, either through actual novel infection or an antibody response due to a vaccine, so that we have most of our folks immune and unable to pass on the vaccine to folks who are not immune. For those of you who have the sentiment that, well, as long as everyone else is immune because of herd immunity, I'll be fine, there's really no way to predict that you will be the one person who's protected by the other 75%. So I encourage everyone to get the vaccine, to ask questions, to get clarification, and then to get the vaccine so that we can all contribute to that 75% or higher to reach that herd immunity. And my friends, that is how we are going to get back to the way of life that maybe are the things that we've been missing. The other way to do that is to continue to see our actual cases go down. Now, you may have been following the numbers nationally and within our state. We are seeing the numbers come down. However, they have started to plateau. We're not 100% sure of that reason. It may be a combination of variant infections along with folks becoming a little more complacent about precautions. So let me reiterate that this is not the time to let down our guard. We need to continue to wear masks. We need to continue to remain socially distant, great hand hygiene, avoid inside large gatherings, all of the things we've been doing until we get to that place where we are safe and can do that. If we relax now, we will see the numbers shoot up. And more concerningly, we will see the number of variant infections shoot up. And we know that our current vaccines are not as effective against the variants. They are still highly effective, but they're not as effective. We also know that the vaccine manufacturers are working on tweaking vaccines so that they will become effective against variants. We don't know if that means a booster at some point. We don't know if that means a vaccine that looks a little different next season. We're not sure what that means yet, but we know folks are working on that. However, if we let the variants and our cases get ahead of us and run away from us, we aren't able to catch up, and we will just be playing this game over and over and over again. So we need to continue with precautions. We've got to keep the infection rate low so that we don't breed more variants and we don't increase our cases. And we have to try to get as many folks vaccinated as possible. I understand that this is a fine line to walk, because while we say we need to get as many folks vaccinated as possible, we also understand that the supply is really, really limited. And there's only so much we can do to get those to get those vaccinations in arms. We are giving every vaccination we get in South Carolina. It's just not enough at this point. I also want to remind you that there is a perk to getting vaccinated, and that is if you've been vaccinated or if you have been COVID positive and it's been within 90 days of 2 weeks after your vaccination and recovery from your COVID infection, you are considered very safe from exposures. In other words, if you find out that you've been exposed to someone with COVID, you don't have to quarantine. This is a big deal for organizations, businesses, and workforce planning, because suddenly now we're not having to send large groups of people home if they're considered immune, either from a novel infection or from the vaccine. So a lot of information today, still a lot of waiting. Okay, and it's really just that we are waiting. We're waiting on supply, but encourage your employees to register for MyChart and business leaders if you're interested in using the VAM system and help and allowing us to help facilitate that for you to get your workforce registered in VAMs. We encourage both tactics. If you'd like to reach out to us about doing some trainings for all of your employees or as part of your employee group so that they can become trainers, we'd love to hear from you. Remember, we also have resources around stress management, employee assistant program content that we want to help you with because we know that this has been a long, hard year for everyone, including your workforces. Reach out to us if you're interested in establishing telehealth connections, episodic care clinics where we're on site for your folks to provide care, possibly vaccines in the future, in the long-term future, we will see. But let us know what you need. We're here to care for you so you can care for your workforce, and I will see you in a few days.